The Centers for Disease Control Advisory Committee last week voted unanimously to add the COVID shot and boosters to the recommended immunization schedule for children 6 months and older. We now wait for the CDC to decide whether to implement this advice, but it's fully expected to do just that. Now, to be clear, this is not a shot mandate. Only state and local governments can impose those. But we've seen blue cities and states using CDC guidance to basically rubber stamp the extreme COVID measures throughout the pandemic. And there can be zero doubt that the Biden administration will then force as many states as possible to require the COVID vaccine. In any government program, may tie strings to the funding, who knows. But as further information on the pandemic becomes known, particularly the minuscule death rate for all people under the age of 70, how should parents respond to this? With me now to talk about this and more is Dr. Robert Malone. He's Chief Medical and Regulatory Officer for the Unity Project and an internationally recognized physician scientist who specializes in advanced development of medical countermeasures to infectious diseases. Dr. Malone, welcome back to the program.
Hi, Tony. Thank you for the opportunity to be here.
Let me first ask you your reaction to the CDC vote last week. Are you surprised at all?
I'm sorry to say I'm not. I'm surprised that there were no people of conscience there, that the vote was twice unanimous. I think that it shows personally, I think that this demonstrates the profound corruption and capture of both FDA and CDC that we've observed all the way through the COVID crisis. And this is perhaps the most egregious example of that.
So, Dr. Malone, before we get into the substance, I just want to be clear because there's been a lot of stuff said last week about the process, how it was misinterpreted. Just walk us quickly through the process for a CDC recommendation. What was done last week? What are the next steps?
The way this works is that you first need a recommendation by the FDA, an allowance, and it's important to remember that in this age cohort, what we're talking about are products which are currently still experimental. They are under emergency use authorization. They are not licensed products. None of us have ever seen anything like this in the past. But the normal process is that one has a meeting of the Vaccine-Related Biologics Advisory Committee. That's the external independent reviewers at the FDA that take up a topic area. Then they make a recommendation. That recommendation is approved or disapproved by the relevant director of the FDA. Then for vaccines, it goes to the Centers for Disease Control and Prevention. And we already had a statement from Rochelle Walensky at the CDC endorsing these products to be used. These are the boosters for children down to 5. But that's not the normal situation. Usually the director of the CDC awaits the Advisory Committee on Immunization Practices, that's the ACIP, which is ostensibly an independent organization or group of individuals which provide consultation to the CDC, but typically have a lot of deep input from the vaccine manufacturers. A lot of this vaccine manufacturer input occurs behind the scenes in closed meetings prior to the open ACIP meeting. At the ACIP meeting, it's basically a small convention of representatives of all of the medical professional societies as an outside ring, and then an inside ring of individuals that have been appointed ostensibly because they have both expertise and no conflicts of interest. One of these members, for instance, in this case, they all declared no conflict of interest. One of them happens to be the wife of one of the lead researchers on this infamous Boston University gain-of-function study. So these individuals meet, have an advisory vote, after receiving various information and presentations, typically from CDC officers as well as from industry representatives. In this case, they did not have the usual CDC scientists making the presentation, but rather had a press officer make the presentation. It was quite superficial. And then we had a unanimous vote, 15-0, both to recommend it for children and then to recommend it being placed on the schedule. What that does is it automatically triggers a purchase of vaccines for the Vaccines for Children program and distribution nationwide. And it typically establishes the standard of care nationwide because you have all of the various medical societies sitting in that outer tier surrounding the inner ACIP group that will comment and concur. Then this basically becomes standard of care for children. And once it's established as a national standard of care, then it gets very hard for individual states or school districts to go against that. And typically that rolls straight into the various federally funded vaccine programs, et cetera.
So technically it's not a mandate, but in effect, it becomes a mandate.
Yes.
By the way the government rolls it out, because so it goes back in this when it triggers for the children's vaccination program, which is for free. Those are provided free for certain children.
I object to that. It's not for free. You and I pay for it.
Well, I understand, but
one of the only programs that basically bypasses congressional appropriation and goes straight from a committee to a government bureaucrat. And then there's an acquisition and distribution using federal funds.
But that becomes oversight. That kind of sets the norm.
Absolutely.
So, okay, that was my point. So let me bring up a couple of points that you brought up. You said that there were no CDC scientists that were there. Now, correct me if I'm wrong.
I'm sorry. What I spoke of was the presentation. The presentations were made. We're not usually the presentations are made by seasoned CDC scientists.
So my question was, and correct me if I'm wrong, but I wasn't it last year that you had CDC, you had career individuals that resigned over the way this vaccination was being pushed out?
No, it was actually the FDA. Those were two senior people in the vaccines branch at FDA that basically conscientiously objected. I think they're the only people in the whole federal government to date that have taken a clear and unequivocal position. I would rather resign than go along with this. Everybody else is pretty much rolled over.
All right. And then you said that this vaccine is still experimental. So I have to ask this question. Are there no standards by which we adopt these vaccines, these shots, making them, in effect mandated? I mean, don't we wait to get the science?
In the past, this has become what we are seeing now, my friend, is the culmination of decades of kind of incremental loosening of norms in the vaccine space and functionally the capture of the entire process, including the ACIP, by the interests of the large vaccine manufacturers. And your point is well taken. It's my principal objection here is that the standards and norms, regulatory norms and clinical development norms that have been in place for decades globally by treaty have been wholesale disregarded. They've been thrown out. And we now know, based on the New York Times article in February and the two administrative state reports that came out about the CDC, that the CDC has been withholding data and it has been weaponized for political purposes. The CDC is functionally a political office now of the executive branch. It is no longer an independent arbiter of public health and scientific truth.
So, Dr. Malone, all right, if people were falling over dead because of COVID, if we were like in that first wave that came back in the early 2020 where it was really significant, we didn't know what we were dealing with, but now we're 2 years removed from that, and we now see that children in particular, in fact, anybody under the age of 70, really is okay if they get these recent strains of COVID. What's the urgency to push this forward? Why not wait for the scientific evidence to come in and study this thoroughly?
It's a mystery to me, and I've said repeatedly, as has the groups that I represent, going back to May 11th, there is no public health emergency. There is no logic that we can see from a medical scientific standpoint to continue the medical emergency that has repeatedly been declared by the White House and which the legislature has refused to act on to rescind. The House and the Senate have the authority to rescind this declaration of emergency, medical emergency, which is what allows all of these policies and basically bypassing significant aspects of the Bill of Rights to proceed. It is all based on this declaration of medical emergency, and there absolutely is no medical emergency, particularly in the case of COVID. Furthermore, the data from all over the world are increasingly demonstrating that the multiply inoculated, particularly those with these bivalent, quote, booster shots, are actually at higher risk for hospitalization and death than those that are naturally immune, for instance, which is the vast majority of us have already been infected at least once, if twice.
Yeah. I've had it twice.
Me too.
I've got the antibodies. I'm good to go. Very quickly, we only got 30 seconds left, but are you concerned about where this might lead beyond COVID?
Absolutely. And I'm here with Children's Health Defense in Knoxville at their conference, and many of us are speaking about our deep concerns. This, what we've had revealed is really a window into a compromised agency that has dual functions: support of the industry and regulation of the industry. And the support of the industry, of the pharmaceutical industry, has clearly overwhelmed the regulatory aspects throughout HHS, and we have a problem.
Frightening. Dr. Malone, great to talk with you. We're going to have to talk again, but we're out of time for today. Good to see you.
Thank you so much.